Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Ultrasound. It's a type of imaging that uses high-frequency sound waves to look at organs and structures inside the body. Things like the heart, the blood vessels, the kidneys, the liver, and of course during pregnancy, you probably remember this, doctors use ultrasound to check up on the fetus. Boy, girl, 10 fingers, 10 toes.
Yeah, just to make sure that everything's right on track.
Yeah, stuff like that.
Traditionally, ultrasound has been used by imaging specialists, radiologists, and cardiologists, but advances in ultrasound equipment, making the equipment smaller and portable, now make it possible for other healthcare providers to use point-of-care ultrasound. That's POCUS, P-O-C-U-S, meaning ultrasound can be used right at the bedside or even during a clinical exam.
Here, let me check that out with my little machine.
Here to discuss point-of-care ultrasounds, or POCUS, is internal medicine specialist Dr. Anjali Bhagra. Welcome to the program, Dr. Bhagra.
Thank you, and thanks for having me here.
Dr. Bhagra, great to see you. Great to have you on the program. Hocus pocus? No, this is the real thing, huh?
This is the
really
real
works.
thing. Thank you for choosing this topic. I think it is so timely. It is being talked about. It's the new trend in modern medicine and how we provide care to our patients.
What's the new way in the way that it's being used?
So as you mentioned, this is being used by the bedside. So what's new is that the patients are not being sent for imaging, but we are coming to the bedside at the side of the patient and doing these imaging tests to decide or further refine the diagnoses to make more sophisticated clinical decisions, but also to guide procedures at the bedside. So a lot of care can be provided at the bedside to the patients versus having to send them to different areas.
You used to have to send a patient down to radiology for an ultrasound. Now you've got it right in your office. It's portable, right? So tell us, what can you find? What are you looking for most often?
So that's a great question because I think it is a very exciting, disruptive technology, as a lot of us like to call it, but it's very essential to right-size it and identify what the correct application and what some of the limitations of this imaging modality are. So some indications at the bedside that are very quick and very easy to do is confirming fluid. So fluid around the lungs, fluid around the heart, especially in a very acute or an unstable patient scenario where traditionally stethoscope was our only way to examine the patient. And although it's called stethoscope, in reality, it truly is a stethophone, because what we are able to do with that is listen to the human body. But what these imaging devices now allow us to do is not only look at the structure of the organs, but also function of the organs at the bedside. So in a scenario where a patient is collapsing in the hospital, it can quickly tell us if there is fluid around the heart that's causing it. Do we need to tap that fluid immediately? Is there a lot of fluid around the lungs? Is there air around the lungs? A potentially life-threatening condition called pneumothorax.
Okay, pneumothorax meaning?
Air around the lungs within the pleural space, which is the space that surrounds the lungs.
And then the lungs can collapse if
Correct.
If you get too much air in there.
Absolutely.
What about other internal organ problems? If you suspect someone might have gallbladder disease, can you look at the gallbladder?
Well, you can look at the gallbladder, but you have to be very careful. Point-of-care ultrasound tends to be a binary decision maker in most cases. We can use it to sophisticate clinical decision making, but we don't want to replace the sophisticated diagnostic tests. For example, gallbladder ultrasound, it can help us get a quick look at the ultrasound, but with the ultrasound at the gallbladder, but it does not allow us to do a very comprehensive scan of the gallbladder.
So you might have to then, if you suspect gallbladder disease on your exam or by history, and then with the ultrasound, then you might send them for a CT scan to confirm that.
Absolutely. Or a formal ultrasound by our radiology colleagues.
All right, bigger machine.
Bigger machines with more functionality.
I just have a question about the size of what we're talking about here. How big did an ultrasound used to be, and how big is it now? I mean, are you talking shoebox size versus car bat? You know, what size are you talking about?
Yeah, and that's a great question, Tracy. Well, when ultrasound was first discovered, you can imagine a big room full of a huge machine. That's kind of the size of what the machine looked like. And now we are talking cell phone. There are actually transducers that plug into your pocket-sized devices, whether they could be small iPads or cell phones. So these are really small handheld devices.
You hold this in your hand?
I
this
actually
ultrasound?
round every time on my hospital service with this machine in my hand. That's my electronic stethoscope.
You ever turned it around and say, I wonder if I got any fluid here? No?
And actually, our patients love it. They get so engaged in their care because for the very first time, they can see what's going on inside their bodies. They can't hear what we are hearing with our stethoscopes, but they get very, very engaged when they see their heart beating, when they see their kidneys, when they can see the stone, when they can see the fluid. And we can monitor daily progress of patients. Another great application at the bedside is actually looking at the inferior vena cava, which is a big vascular structure. It helps us assess the hydration status of patients, which is a very common, very, very common issue that we encounter in outpatient and inpatient settings. And this is something that comes in so handy, and it helps us counsel our patients.
I would imagine you've probably got hundreds. Just hearing you talk about it, there's probably hundreds of examples. But can you tell us, share a story with how this POCUS helped you with a patient?
Yes, absolutely. I have many stories, but one that really stands out is the case of an 80-year-old lady who was admitted to our hospital service with low sodium levels, and the team had thought that she has high fluid levels, so they were getting ready to tap her belly to pull fluid out. We brought the handheld ultrasound machine. She actually had no fluid in her belly, and her vessels were completely collapsed. So she actually needed more fluids in her body versus us pulling fluid out of her body. That immediately changed our plan within 2 minutes of getting that machine at the bedside.
Saved her a poke, too, didn't it?
Totally. An invasive procedure that would not have had a high yield at all.
Are there any drawbacks? Now, I know that this is radio frequency, so there's no radiation involved. Are there any potential complications with the use of this little device?
I think there are no technical or radiation-related complications, but one big factor involved in the learning curve of point-of-care ultrasound is operator variability, because this is a very operator-dependent test. So we want to make sure and be absolutely confident that people who are using it know how to use it and know exactly what they're looking for. So I think a knowledge gap or a learning curve issue can be a big barrier in adoption.
Putting POCUS training on your schedule is what you need to do, Tom.
I think I'm just going to leave it up to Dr. Bhagra. Actually, it's
I'm
better
happy
in her
to.
hands than mine. So how many physicians at the clinic have this?
So actually, we have been blessed. There are more and more practices acquiring machines. Our hospital medicine has units. We have a new, within our training programs, we have new services that teach our trainees procedures with integration of ultrasound. I run ultrasound rounds for our trainees. So we have quite a handful of equipment floating around our clinic now.
Wow, miniaturization at its best. Point of care ultrasound, Dr. Anjali Bhagra, internal medicine specialist at the Mayo Clinic. Thanks so much for being with us.
Thank you so much for having me.